Hi, Lorene here. I have Bob, who's interested in giving us some information in regards to healthcare that he's experienced in Italy.
Yeah, they have good doctors and everything over there, and hospitals good and bad. But the system is there's a lot of waiting. I mean, you just to get an appointment with your primary care doctor, if you get up early in the morning, you can sort of beat the lines. But if you're not early, you get 100, 200, 300 people can wait in line just to get your card signed. Then you get the card signed, and then you go and then you go maybe a week, 2 weeks, even 3 weeks later, you get to see your primary care doctor. He'll give you, once you get there, he'll give you the time. It'll be nice and all this kind of thing. And then if you need a specialist, he assigns you to a specialist or anything like that there. I mean, I just found that, a lot of people who were over there, some Italians and a lot of foreigners, they would go to, I lived in Rome, and they'd go to the private hospital, Salvatore Mundi, and just, cut through the chase and pay privately over there.
So you're saying that when you're sick, you go to your doctor's office and stand in line for 100 to 300 people, and that's just to get a card signed to get you maybe a week or two later an appointment with the physician?
Just to get an appointment, yeah.
I wasn't aware of that. Thank you. That's very interesting.
Yeah. I really think we've got the best healthcare system. I had my sister-in-law. She couldn't get a care for her. She had a cataract, not a cataract, a retina, disconnected retina, and she couldn't get the thing over there. She had to come over to America. A lot of people, this is the best healthcare. It's got its flaws, believe me. I think changes have to be done, but with the insurance I used to work in the healthcare insurance field here in the United States, and there's got its flaws. I mean, I think more people have to be cared. I think, if I want, some of my family, myself, if we want to go, we're independent workers sometimes, and I'd like to be able to go over state lines, maybe have a little more freedom and do some work for a different company, but you're kind of tied down because there's no portability. And I just can't see the reason why that can't be done. I mean, the president says that's too difficult, but they're going to tackle something which is very difficult, which is giving. I don't think they have the money to be able to do what they want to do, but they can't do portability. I just don't understand that at all.
As an insurance, you worked in the insurance field?
Yeah, I worked in a little bit.
Are you familiar with community and individual ratings?
Not really. I worked in California for HMO. It was Medicaid, which is in the other parts of the country they call it Medi-Cal, and so I'm quite familiar with what goes on there. How the managed care, health care. I'm quite familiar with that. And California is a perfect example of. They just give out health. I'm kind of divided on it. I have a compassion for people, but they just give everything out so freely that it's really burdened the economy. They're really, really bad. And I used to see the same people go to the hospital. They'd be on Medicaid, and they would go. They'd say, "Hi, Mr. My name." And I'd see him. I'd say, "You back again?" They just, "What are you doing here?" Just passing time to go to the emergency room over and over again.
Do you feel that would happen if we had a national health care plan?
It might. I'm not totally against it. I'm against a single payer for sure. And I think people have to be covered. I think there's got to be a way of everybody gives something, whether it be do some work, or if you're not physically able to do the work, have maybe a family member do the work and pitch into maybe have a family fund where if you're not physically able to do the work, someone else can do something to do some work for you. I just think everybody should be able to at least try to pay or pay something or give some work in return. Otherwise, if this is a piece of paper, if you got this piece of paper, and this is if you got this many people getting health care now, and then later you're going to have this many people getting health care, but the funds to do it are cut down, how are you going to give this many people that health care with less funds? I just...
That's a good point. That seems to be some of the points that are very confusing to some of the people in our area.
And I'm afraid, I've had my parents and had my poor mom, and I'm afraid that, maybe there's not like a death squad, but I've had, believe me, they pressure you, and I don't want to get into the details of what went on with my mom, but the people come around and they try to make you feel guilty if you're not, and I'm talking about a few years before my mom went, and they just try to say she's, believe me, they put the pressure on.
Here in America?
Here in America, yeah. And I'm just afraid that I want to be the one making that decision. If one of my parents or family members can't make that decision, I don't want someone to make it before. Maybe it's not a death squad, but I think the pressure would be probably up. And I don't understand. The hospitals have those people already who I can't remember what they call them, but they're there.
Social services
people, and why do you have to create another team? They already have those people who do that. And so if they need to create some kind of board or overseers and pay, they're talking about we have to pay them. They already have that. I don't understand the need for that. I want to be the one making the decision for my family members. So I really think healthcare is needed. Pre-existing conditions. I think insurance companies can be greedy on that, and I think that's got to be done away with. I think people should be able to move to wherever they go and be able to, transport their insurance. And there's some. So it's not all one way, but we really have to be careful about just having the government take over. I'm not a huge fan of government agencies. They do a good job with the military. I think they do all right with the post office for what they have, but I'm afraid of getting the foot in the door and then going, if something like a co-op start to fail because they don't have the money because everybody's going there, then at that point, what if the government takes over then and, say, just like they do with a car industry or something, and then they really get a hold, and I think so I'm not against big changes, but let's take our time and do it right. That's my opinion.
Thank you so much.
Okay.
Appreciate your time.
Okay, yeah.